So when we look at injectables, and as I say, we have a little bit of a reflex of we give this to everybody, right? You don't actually need a prescription for it. So it can actually be something that can be done at a pharmacy, for example. But it's an injection every 8 to 12 weeks, depending on which one you're on. It's got less drug interactions than our estrogen-based ones. And so therefore you can also use it safely in our over 35-year-olds and our postpartum women. But there's a few concerns with the injectables. And don't worry, I'll talk about the meningioma thing separately. But weight gain, definitely a major issue. There have been linked that if you use it for many, many years, there's definitely a bone marrow density loss. So there becomes an increased risk of osteoporosis. There is a bit more of an increased risk of DVT, although not as much as with the others. It's a hormone. So your hormone cancers are obviously potentially possible. Some people do bleed on it. And some people do get some mood and nausea and fatigue on it. Probably one of the biggest issues is the fertility delay, especially in our population. So a lot of young girls, we just put on the Depo-Provera, and then by the time they stay on something for years, and then by the time they go off it, it takes them ages to actually fall pregnant. It takes them ages even just for their cycle to return. And when the cycle returns, it's quite often very irregular. So this is potentially an issue, and a very important issue that we need to discuss with them. So there are two medroxyprogesterone preparations, which I did not know. And did you know that there's a subcutaneous version that works as well as the intramuscular version? It is written in the EML, but I don't know if they have it on tender or not. It is SAPRA registered in South Africa, but I'm just thinking it's such a painful injection. And it has to be done at, with a nurse at a clinic, where a subcut you could even do yourself, and can be done, it's much less. So anyway, that's just interesting. And then nuristerate, which is every 8 weeks. So we're sort of a little bit patronizing with our patients that we go, 3 months is by far the easiest, and we just routinely put people on Depo-Provera. Excellent 0.2, that 6% failure rate is for people who are not coming on their routine visit, and then obviously the failure rate is higher. So again, we want to give it within the first week. We can give it at any time, but if you give it within the first 7 days of the cycle, then they're protected. If it's after that, then you tell them to use 7 days of protection. Just notice there are a 2-week leeway. So we say 12 weeks, but up to 14 weeks is 100% fine. And it's only if it's after 14 weeks that we are concerned that they might have been at risk. So some of you might have seen, I think the headlines was something like, injectable contraception causes brain tumors. I don't know if any of you saw that, came out in January of this year. It's from two large epidemiological studies in France and the USA, where they've noticed that there was 32 cases that was reported over a 20-year period. This is what this all is based on, with an increased risk of meningioma in patients on medroxyprogesterone specifically. So that translates to a 1 person for every 1,100, I don't know who did that maths, patients taking on, so if you're on the injection for 3 years, 1 out of 1,111 patients has got an increased risk of meningioma. How you explain this to patients, I don't know. It's one of the risks is a very difficult conversation to have. It has caused some alarm. And it's definitely dose cumulative. So the issue is with how many years you've actually been on this drug. So interestingly, the recommendation generally with Depo is that we should really reconsider its use after 2 years. Nobody does that. Generally, because also of the bone marrow density loss, because of the reduced fertility, this is a nice short-term option, but actually after 2 years, maybe start looking if there's not other options that are better. So this is a little bit of a thought. So if we talk about the hormonal subdermal progestin only implant, so this is our Implanon, and that's been a nice option that came available in the past few years as well.